Do you dismiss fatigue or blurry vision as just getting older? What if those subtle changes are actually your body whispering a silent warning? Medical professionals agree that diabetes symptoms in seniors are often atypical, easily mistaken for normal aging. You might think it's just a senior moment when memory falters, or a new ache that's simply wear and tear. But overlooking these seemingly innocuous signs can lead to serious, preventable complications. If you care about your health after 60, this is a video you'll want to watch till the end. As we gracefully navigate the golden years, our bodies naturally undergo changes, and it's easy to attribute new aches or shifts in energy to just getting older. However, understanding certain health signals becomes incredibly important for maintaining our independence and vitality. Diabetes, a chronic condition where your body struggles to manage blood sugar, is one such area where awareness is key. For those aged 60 and above, the warning signs can be particularly subtle and easily mistaken for common age-related changes, or simply dismissed. This makes early detection challenging, yet incredibly vital. Left unmanaged, diabetes can silently erode your quality of life, impacting your vision, nerve health, leading to foot problems, and kidney function. It can sap your energy, making daily activities feel like a chore, and increase the risk of heart disease and stroke. Understanding these often overlooked signs isn't about fear, it's about empowerment, giving you the knowledge to act early, manage your health effectively, and continue enjoying the vibrant, independent life you cherish with family and friends. Alright, let's dive into our first crucial warning sign, one that is incredibly common but often dismissed, especially in older adults. Unexplained, excessive thirst and frequent urination. Now, it's natural for our bodies to change as we age. Bladder control might not be what it once was, and many seniors make a conscious effort to stay well hydrated, which is commendable. But we're talking about something beyond the usual here. We're talking about polyuria, which is the medical term for passing abnormally large amounts of urine, and polydipsia, an intense, persistent thirst that no amount of water seems to quench. Here's why this particular duo is so easily overlooked in seniors. For one, increased nighttime urination, or nocturia, is often attributed to a weaker bladder, prostate issues in men, or even certain medications. Similarly, a dry mouth might be blamed on medication side effects or simply not drinking enough water, leading to a cycle where more water is consumed, thus leading to more urination, seemingly confirming the initial thought process. The key distinction, however, lies in the degree and persistence of these symptoms. Are you finding yourself needing to urinate far more frequently than usual, perhaps every hour or two, and waking up multiple times throughout the night with an urgent need to go? And is your thirst so profound that even after drinking several glasses of water, you still feel parched, almost as if your body can't absorb the fluid? The physiological reason behind this is directly linked to high blood sugar levels. When your blood glucose is elevated, your kidneys, which are normally responsible for filtering waste and reabsorbing essential substances like glucose back into the bloodstream, become overwhelmed. They simply can't keep up with the amount of sugar in your blood. To try and get rid of this excess glucose, your kidneys start to excrete it through your urine. And here's the critical part. Glucose is an osmotic diuretic. This means it pulls water along with it. So, as your kidneys are working overtime to flush out the sugar, they're also pulling significant amounts of water from your body's tissues, leading to that excessive urine output. This dramatic fluid loss then triggers your brain's thirst mechanism, urging you to drink more to compensate for the dehydration. It's a vicious, self-perpetuating cycle. High sugar leads to more urination, which leads to more thirst, and so on. This isn't just a minor inconvenience. It's your body desperately trying to signal an imbalance. So, if you or a loved one are experiencing a noticeable, persistent increase in thirst and urination that feels out of the ordinary, and it's not easily explained by other factors, it's a sign that warrants immediate attention and a conversation with a healthcare professional. Don't simply dismiss it as just getting older. Have you experienced this? Share in the comments. Moving on to our next critical warning sign, one frequently dismissed as a natural part of aging: recurrent infections, particularly urinary tract infections, UTIs, and yeast infections. For many seniors, an occasional UTI might not raise immediate concern. However, when these infections become frequent, difficult to treat, or stubbornly return, it's a strong indicator that something more fundamental might be amiss with the body's metabolic balance. The underlying mechanism is directly linked to elevated blood sugar levels, a hallmark of undiagnosed or poorly managed diabetes. High glucose in the bloodstream creates an environment ideal for bacteria and yeast. When blood sugar levels are consistently high, excess glucose spills into the urine, known as glycosuria. This sugar-rich urine acts as a potent fuel source for urinary tract bacteria, leading to rapid multiplication and persistent or recurrent UTIs. Similarly, for yeast infections common in women, elevated glucose in mucous membranes provides an ideal breeding ground for Candida albicans. Furthermore, chronic high blood sugar impairs the immune system's ability to effectively fight pathogens, increasing senior susceptibility to infections. This warning sign is often overlooked in seniors for several reasons. Firstly, seniors are already predisposed to UTIs due to age-related changes like bladder prolapse or incomplete emptying, often mistakenly seen as the sole cause. Secondly, both patients and healthcare providers might treat the infection symptomatically without routinely investigating the root cause, particularly if other classic diabetes symptoms aren't prominent. A senior might report multiple infections over a year, but if each is treated in isolation, the pattern linking them to diabetes can be missed. Their commonality in older populations can unfortunately normalize recurrence, leading to a missed opportunity for early diabetes diagnosis. Overlooking this persistent pattern of infections can have serious consequences, delaying a diabetes diagnosis and allowing the condition to progress, leading to severe complications. It also fosters antibiotic over-reliance, contributing to resistance and raising the risk of serious infections like kidney infections or sepsis. Therefore, if you or a senior loved one are experiencing frequent or stubborn urinary tract or yeast infections, it's crucial to consider diabetes as a potential underlying cause and discuss comprehensive blood sugar testing with a healthcare provider. Have you experienced this? Share in the comments. Moving on, our third crucial warning sign, and one that is especially insidious in seniors, is persistent and overwhelming fatigue and weakness that goes beyond typical tiredness. It's easy to dismiss feeling tired as a natural part of aging. After all, energy levels do tend to dip as we get older. However, the fatigue associated with undiagnosed or poorly managed diabetes is different. It's a profound, unremitting exhaustion that isn't relieved by a good night's sleep or a relaxing break. This debilitating fatigue stems from several core issues within the body when diabetes is present. Primarily, your body cells are being starved of their main energy source, glucose. Even though there might be plenty of glucose in your bloodstream, insulin resistance or insufficient insulin production means that sugar can't effectively enter the cells to be converted into energy. Imagine trying to run a car without fuel, even if the gas tank is full but the fuel line is blocked. Your body feels similarly drained and sluggish. Beyond this cellular energy crisis, the kidneys are often working overtime to filter out excess sugar, leading to increased urination and potential dehydration, which further saps energy and can disrupt electrolyte balance. Chronic inflammation, a common companion to diabetes, also contributes significantly to this pervasive feeling of unwellness. Moreover, frequent nighttime urination can interrupt sleep cycles, preventing the restorative rest needed to combat fatigue. For seniors, this specific symptom is frequently overlooked because it mimics the general slowdown many experience with age. A grandparent might attribute their newfound difficulty with daily chores, climbing stairs, or even just staying awake during the day to simply getting old. Family members might also unknowingly reinforce this by suggesting they take it easy. But if this fatigue is so severe that it interferes with daily activities, reduces participation in hobbies, or prevents simple tasks like walking to the mailbox, it warrants immediate attention. It's not just a feeling of being a bit tired, it's a profound lack of energy that impacts quality of life and is often accompanied by a distinct muscle weakness. This isn't the fatigue from a busy day. It's a persistent, deep-seated weariness that no amount of rest seems to resolve. Recognizing this distinction is vital for early diagnosis and intervention. Have you experienced this kind of persistent, unexplained fatigue? Share your thoughts and experiences in the comments below. Next, let's discuss a crucial warning sign that often gets dismissed in seniors: the presence of slow-healing sores or frequent, recurring infections. It's easy to attribute a lingering cut or a stubborn skin infection to the natural aging process, thinking perhaps the skin is just more fragile or the body slower to recover. However, for seniors, these seemingly minor issues can be significant indicators of underlying diabetes, demanding closer attention and investigation. The primary culprit behind this phenomenon is consistently elevated blood sugar levels. Over time, high glucose in the bloodstream can damage small blood vessels throughout the body, a condition known as microvascular disease. This damage impairs circulation, particularly to the extremities like the feet and hands, and also to the skin. When blood flow is compromised, essential oxygen, nutrients, and immune cells struggle to reach a wound site. Without these vital components, the body's natural healing process is severely hampered, causing even a small scratch or blister to take weeks, or even months, to heal, if it heals at all. Beyond poor circulation, high blood sugar also directly impairs the immune system. Glucose-rich environments are a breeding ground for bacteria and fungi, making infections more likely to occur and harder to clear. Moreover, elevated glucose levels can directly weaken the function of white blood cells, which are the body's frontline defenders against pathogens. This means that seniors with undiagnosed or poorly managed diabetes are not only more susceptible to common infections like urinary tract infections (UTIs), yeast infections, oral thrush, genital infections, and skin infections, boils, cellulitis, but these infections also tend to be more severe and recurrent. Furthermore, diabetic neuropathy, or nerve damage, which is another common complication of diabetes, can contribute significantly. Numbness in the feet, for instance, means that a senior might not even feel a cut, blister, or pressure sore developing. By the time it's noticed, the wound might already be deep and infected, making treatment considerably more challenging. The combination of impaired sensation, poor circulation, and a weakened immune system creates a dangerous trifecta, elevating the risk of serious complications like diabetic foot ulcers and, in severe cases, even amputation if infections spread unchecked. Therefore, any persistent wound or unusual frequency of infections in an older adult should immediately prompt a discussion with a healthcare provider to rule out diabetes. Have you experienced this? Share in the comments. Next, let's discuss a warning sign that is perhaps one of the most frequently overlooked, especially in our senior population: unexplained mood changes and increased irritability. It's easy to dismiss a senior's sudden grumpiness, anxiety, or uncharacteristic withdrawal as just getting older, stress, or a reaction to other life circumstances. However, these shifts in emotional well-being can be a crucial indicator of underlying blood sugar dysregulation. The connection between fluctuating blood sugar levels and mood is profound and physiological. When blood sugar is consistently too high, or swings wildly between high and low, it directly impacts brain function. Our brains rely heavily on a steady supply of glucose for energy, but too much or too little can disrupt its delicate balance. High blood sugar can lead to inflammation and oxidative stress in the brain, affecting neurotransmitters like serotonin and dopamine, which are vital for mood regulation, feelings of well-being, and cognitive function. This imbalance can manifest as increased irritability, anxiety, depression, difficulty concentrating, or even confusion. Imagine trying to run a complex machine on inconsistent power. It's bound to malfunction. Furthermore, the physical discomforts associated with undiagnosed diabetes can significantly contribute to a senior's mood changes. Constant thirst, frequent urination, fatigue, blurred vision, or slow-healing sores are all incredibly draining. Chronic discomfort and poor sleep, often caused by nocturnal urination, can naturally lead to frustration, impatience, and a general sense of unease. A senior who feels unwell day in and day out is far more likely to exhibit irritability or withdraw from social activities, making it easy for family members or caregivers to misinterpret these behavioral changes as something other than a medical symptom. It's vital for caregivers and family members not to brush off these emotional shifts as merely a part of aging. While aging certainly brings its own challenges, significant or sudden changes in personality and mood, particularly when combined with other subtle physical symptoms, warrant a closer look. They are not just psychological. They can be a direct cry for help from a body struggling to manage its glucose. Paying attention to these often dismissed behavioral cues can be the key to early detection and intervention, significantly improving a senior's quality of life. Have you experienced this either personally or with a loved one? Share in the comments. Next, let's discuss a warning sign that is particularly insidious because it's so often dismissed as a natural part of aging: numbness, tingling, or burning sensations, especially in the feet and hands. This symptom, known as diabetic neuropathy, is a direct result of prolonged high blood sugar levels damaging the delicate nerves throughout the body. In seniors, these sensations are frequently attributed to poor circulation, arthritis, or simply getting old, leading to dangerous delays in diagnosis and treatment. Diabetic neuropathy most commonly manifests as peripheral neuropathy, affecting the nerves in the extremities. You might notice a creeping numbness, a pins and needles tingling sensation, or even sharp, burning pains that can be excruciating, particularly at night. Some individuals experience a heightened sensitivity to touch, where even the lightest blanket can feel unbearable, while others may lose sensation altogether, making them unaware of injuries. This loss of protective sensation is incredibly dangerous, as seniors might not feel a cut, blister, or pressure sore on their foot. Without prompt attention, these unnoticed injuries can become infected, leading to severe complications, including ulcers and, in extreme cases, amputation. The mechanism behind this nerve damage is complex, but it primarily involves high glucose levels impairing the function of nerve fibers and damaging the small blood vessels that supply the nerves with oxygen and nutrients. Over time, this deprives the nerves, causing them to malfunction and eventually die. What makes it particularly concerning in seniors is that many already have some degree of age-related nerve changes or other circulatory issues, making it easy to conflate these symptoms with pre-existing conditions rather than suspecting new onset or worsening diabetes. It's crucial to understand that while some aches and pains are common with age, persistent numbness, tingling, or burning, especially when it follows a pattern, like starting in the toes and moving up, is not normal and warrants immediate medical investigation. Early detection and aggressive management of blood sugar can halt the progression of neuropathy and, in some cases, even improve symptoms, safeguarding mobility and preventing devastating complications. Have you experienced this? Share in the comments. Moving beyond the more commonly recognized physical symptoms, our seventh warning sign delves into an area that is particularly insidious because it's so often dismissed as a normal part of aging: unexplained cognitive changes or brain fog. For many seniors, a slight decline in memory or a feeling of mental sluggishness is unfortunately, and often incorrectly, chalked up to simply getting older. However, these subtle shifts in mental clarity can be a significant, yet overlooked, indicator of developing or poorly managed diabetes. The brain, despite its small size, is a massive consumer of glucose, its primary fuel. When blood sugar levels are consistently too high, hyperglycemia, or fluctuate wildly, the brain's ability to function optimally is severely compromised. High glucose can damage blood vessels, including those supplying the brain, leading to reduced blood flow and nutrient delivery, a condition known as vascular cognitive impairment. Furthermore, chronic inflammation and insulin resistance, hallmarks of diabetes, directly impact brain cells and neural pathways, affecting everything from memory recall to processing speed. Seniors might experience difficulties with executive functions like planning and problem-solving, reduced attention span, or a general feeling of mental fogginess that makes everyday tasks more challenging. Caregivers and seniors themselves might notice a loved one struggling more with complex tasks, exhibiting mild confusion, or having difficulty concentrating during conversations. These struggles, like forgetting appointments, losing track of conversations, or taking longer to process information, are often dismissed as mere senior moments. What they might not realize is that these aren't just benign age-related changes. They could be direct consequences of uncontrolled blood sugar levels impacting the brain's delicate chemistry and structure. While diabetes does significantly increase the risk for Alzheimer's and other forms of cognitive decline over time, we're focusing on more subtle, often fluctuating, difficulties with attention and short-term memory that warrant a closer look at metabolic health. Overlooking these cognitive signs means missing a crucial opportunity for early intervention. The longer blood sugar levels remain uncontrolled, the greater the potential for irreversible damage to brain function. Addressing blood sugar imbalances through diet, exercise, and medication can often alleviate these cognitive symptoms and, more importantly, help prevent more severe, irreversible brain damage down the line, preserving mental sharpness and independence. It's a vital call to action to consider diabetes as a potential culprit when mental clarity begins to wane, rather than immediately assuming it's an inevitable part of aging. Have you experienced this? Share in the comments. Moving on to our final, and perhaps most insidious, warning sign often overlooked in seniors: subtle cognitive changes and increased confusion. While it's commonly and often mistakenly attributed solely to just getting older, a noticeable decline in cognitive function, memory issues, or episodes of disorientation can be a critical indicator of uncontrolled blood sugar levels or the long-term effects of diabetes. This isn't necessarily about a sudden, dramatic shift, but rather a gradual, sometimes intermittent, decline that might manifest as difficulty managing daily tasks, forgetting appointments, struggling with problem solving, or experiencing increased brain fog. There are several mechanisms through which diabetes can impact brain health and cognitive function. Firstly, chronic high blood sugar, hyperglycemia, can damage the small blood vessels in the brain, leading to what's known as microvascular complications. This impairs blood flow to crucial brain regions, starving them of oxygen and nutrients, and over time, can contribute to vascular dementia or accelerate other forms of cognitive decline. Secondly, episodes of very low blood sugar, hypoglycemia, which are more common and often less symptomatic in seniors, can acutely mimic severe confusion, disorientation, and even stroke-like symptoms. The brain relies heavily on a steady supply of glucose, and when that supply is critically low, its function is severely compromised. Repeated or severe hypoglycemic episodes can lead to lasting cognitive impairment. Furthermore, emerging research suggests a link between insulin resistance in the brain and neurodegenerative diseases, with some scientists even referring to Alzheimer's disease as type 3 diabetes. The brain's ability to utilize glucose effectively can be compromised in insulin-resistant states, leading to energy deficits and the accumulation of abnormal proteins associated with cognitive decline. This complex interplay often goes unnoticed because family members or even healthcare providers might attribute these changes to normal aging, other medical conditions, or medication side effects, rather than investigating underlying metabolic imbalances. Recognizing these subtle cognitive shifts as potential diabetes warning signs is crucial, as early intervention to manage blood sugar can significantly mitigate or slow down further neurological deterioration. Have you experienced this or observed it in a loved one? Share in the comments. Here are 8 practical, safe, and moderate health tips related to observing potential warning signs. 1. Notice changes in hydration and bathroom habits. Be mindful if you find yourself unusually thirsty or needing to use the restroom much more frequently, particularly at night. It's a gentle signal worth observing. 2. Acknowledge persistent fatigue. If you're experiencing unusual or ongoing tiredness that isn't relieved by rest, it might be helpful to consider what could be contributing to it. 3. Observe vision clarity. Pay attention to any new or increased blurriness in your vision. Sometimes subtle changes can be an indicator of underlying health considerations. 4. Monitor skin health and healing. Take note if cuts, sores, or infections seem to be taking longer than usual to heal, or if you notice persistent dry, itchy skin. 5. Be aware of sensations in extremities. If you experience new tingling, numbness, or pain in your hands or feet, it's a good idea to mention these sensations to a healthcare professional. 6. Track unexplained weight changes. If you notice weight loss without trying or significant weight gain, it's worth considering the potential reasons behind these shifts. 7. Prioritize regular health checkups. Routine visits with your doctor provide an excellent opportunity to discuss any new symptoms and for early detection of various health conditions, including diabetes. 8. Embrace balanced lifestyle choices. Engaging in moderate physical activity and choosing a varied, nutritious diet can positively support your overall well-being and help manage blood sugar levels. So, if this message resonated with you, if it sparked a thought or touched your heart, please take a moment to hit that like button, share it with someone who needs to hear it, and subscribe to join our growing family. Your support truly fuels us. And we absolutely can't wait to read your unique experiences and insights in the comments below. Your stories enrich us all. To our incredible seniors, remember that your wisdom is a treasure, your journey is far from over, and every single day is a new opportunity to learn, to love, and to shine brightly. Keep living fully,